Hi, everyone. It's Lauren Gates, and I'm so excited to be here today with Brittany Sierra and Carice Laguerre. We know there's so much excitement and curiosity about myofunctional therapy and what a myofunctional therapist does and how to become a myofunctional therapist, and sometimes even what is myofunctional therapy. So I thought we'd just jump on here and have a casual conversation. Why don't we kick it off? Because I don't know if people know a lot about your journey, your personal journey from transitioning, both of you, from RDH to OMT. And Brittany, I'm going to start with you. Why don't you share with us what made you decide to become a myofunctional therapist? How were you introduced to it?
I was actually introduced to it through an article in RDH magazine by Joy Moeller. I read the article. I was super intrigued by it. I had to know more, so I did my research. And as I was, researching more on it, I was like, wow, this makes sense. Because, as a hygienist, like things happen to your patients and, they're breaking teeth all the time. Why? Like, are they literally out there chewing rocks? We know they're not doing that. So why are they breaking these teeth? And we keep, replacing the crowns and recommending night guards. And something just didn't click. And I wanted to learn more. And this just seemed like a good transition for me. So it just so happened, I read that article in like February, April, I took my first myo course. It was local to me. I'm from Connecticut. It was in New York. And the rest was history. I came back, I started my myo practice, and now here I am 6 years later.
Great. And Carice, I'm going to get right to you, but just on that point, you make it sound so easy, Brittany. You just came back and you started your myo practice. Was it that simple when you first? Okay.
It definitely wasn't that simple.
Right,
No. But I knew that this is the journey that I wanted to take. So, I think you start to network, and some people start to network before they even take their first intro course, because of course you want to know like who in the area is into Airway or doing appliance therapy and whatnot. And I think that, even if you don't have that provider in the area, I don't think that means you shouldn't take the course. But yeah, slowly but surely, like you grow, you network, you become like this little Airway family with all of your colleagues. It's pretty awesome.
Right. Great. Thanks. And what about you, Carice? What made you, and what year, how long ago did you decide to become an OMT?
Well, I first learned about myofunctional therapy in 2014 from a pediatric dentist that I was working with. It wasn't until about 2016-ish or so where she left the practice where we were both working and I went to go work for her that she was like, no, you really have to do this. And we started taking courses together and I was convinced, but not convinced, right? So it wasn't until like 2017 that I was like, all right, let's take a course, because this is something that I see is definitely happening in all these pediatric patients I've been seeing over these years, and it's definitely occurring in my own home. And at this point, we've got to get to the root of this. And once I took my first course, I fell in love. I mean, I took a course and then I took a course the weekend after, and then I took a course the weekend after that. And then a few months later, I took my second course. There's so many things that have happened since then, but it's a constant learning process. And it's been quite the journey.
Just like Airway, at Airway Health Solutions, we teach dentists how to integrate Airway Health Solutions literally into their practices through myofunctional appliances, through expansive appliances, of course, coupled with myofunctional therapy. That's why we brought you guys on board with Airway Health Solutions. But just the Airway component to me, even as a hygienist, you have so much responsibility and opportunity to really screen for airway disorders. You don't have to be a myofunctional therapist to do that. So I'm really calling on all hygienists to just learn a little bit more about airway screening and whatnot. And what would be your advice to them to just learn about basic airway and how to do a basic screening?
Yeah, I mean, I think 3 simple things that they can do in the operatory is we all have cotton rolls. Take that cotton roll and measure between 3 and 14 and make sure you know what your cotton roll is. Generally, it's about 37 millimeters, and see, are you shoving that thing up there? Is it fitting there? Is it space? Or do they have crowding? Really, one of the biggest things that frustrates me is hygienists don't tend to look at occlusion. Like we don't really focus on, we should, but it's not always in every hygienist's clinical notes. And I think that you know, Engel's classification isn't obviously all that we want to go by, but looking at the teeth, seeing that malocclusion, thinking to ourselves, why do they have crowded teeth? Like we should
Right.
have room for all 32 teeth, and then getting them that referral and understanding what that narrowness means. You don't have to practice myofunctional therapy, but you need to know like what can happen if this patient does have malocclusion. What does it mean? What other comorbidities may they have that can be associated with it?
And we did a whole conversation on just this topic alone that's archived on our Airway Health Solutions. If you go to airwayhealthsolutions.com/podcasts, you can go right to our archived. And we had a whole hour about how to, as a hygienist, just really get more intuitive into airway. But I think the next natural step would be really, because it's in the scope of practice, would be to learn myofunctional therapy. That's what I did in 2013. I did take a course with AOMT. And I knew I wasn't going to be practicing it. I just wanted to know more about it. I'm just a curious soul. That's just the way I am. So it's not like you have to become a therapist to learn more knowledge. I always like to get to the base of the root cause. Like, why is this happening? So Carice, what would be your recommendation if someone, say they didn't want to take a full journey, but just to be a little bit more mindful of airway in their normal hygiene practice?
I'd say that sometimes it's the things that you notice, but that you're not necessarily looking for. So the patients that have that strong gag reflex or have difficulty, controlling their tongue, they're fighting you with that lower lip as you're just trying to scale, you're just trying to do your job, and the patient just can't cooperate, right? Those things should be like red flag. You're not looking for them, but you know who those patients are. You see them on your schedule and you cringe a little bit. They might be the ones who can benefit the most from that. And I would say at that point, just think about what you could do to maybe help them. And in the long run, it'll help you too.
And I remember having the airway conversations chair side. Patients were always like mind blown when I told them their cold sensitivity had to do with underdeveloped arches or narrow arches. I almost called it narrow arch syndrome, where it's like, okay, this is where you kind of like that V-shaped arch and you're getting the sensitivity because your teeth are colliding rather than sliding, causing, traumatic occlusion and recession, and then ultimately cold sensitivity. So it's really amazing how so many symptoms are traced back to the root cause of underdeveloped jaws. So to me, it's fascinating. And more importantly, it's so motivating that you can get to the root cause. And now the narrow arches, I'm going to take this a step further, is from soft tissue dysfunction. So that's when I was mind blown, because at first I thought it was just malocclusion. Well, malocclusion is the root cause, but soft tissue dysfunction is the root cause of malocclusion. So that's where you want to get to, right? So you can't say why anymore. So let's talk a little bit about myofunctional therapy. Can you just give us an overview of what it is, almost like myofunctional therapy for dummies, just a really brief overview of what it is? No offense to anyone.
If I'm making myo as a definition for dummies, I would honestly say I compare it to personal training. It's just like personal training for all the muscles below the eyes, but above the shoulders. We're working on functional strengthening and eliminating those compensatory patterns that are at the root of a lot of the dysfunction that we're seeing physically.
I like that. Anything you want to add to that? Or Carice got that pretty spot on.
Yeah, I think that is easy to understand by obviously not only professionals, but the lay person as well. I mean, everybody knows what personal training is and how it works, and how it only works if you actually go and do it, right? It's that learned behavior and repatterning of the muscles and the consistency and doing things with intention that really matters.
Absolutely. So you guys took this a step further. You're both practicing myofunctional therapists, but you wanted to create a course to help others. So let's talk about the three audiences basically that we created these courses for. Number one is probably the most popular, would be the hygienist wanting to go from RDH to OMT. So what makes your course, our course that we collaborated on, integrating myofunctional therapy? What are three things that the hygienist will benefit from taking our course?
Well, I think for starters, you're going to learn not only what myofunctional therapy is, how to do it, but how to actually integrate it into your practice, because you can take a myofunctional therapy class all day long, but if you don't know what to do with it, you're not going to be able to utilize all those awesome tools that you have now.
Wonderful. So integration, right? And then Carice?
I think the biggest part for me was knowing what to do with, yes, all that information, right? But what to do with it when I had a person in front of me that I needed to explain it to. So I think as a hygienist, it's really important to us that when we were developing the course, that we were speaking from that perspective so that we could relate it to the patients. I mean, conversion is everything.
That's true. Okay, so integration, conversion, and the third, I know there's many, but let's go with the top three.
Troubleshooting is huge. Not every patient is a unicorn. No patients actually are unicorns when it comes to myofunctional therapy.
Right.
So, it's great to have maybe this general flow of what you need to follow, but then what if that doesn't work? You have to know how to troubleshoot those tough cases. And we spend a whole hour and a half talking about that. So I think that's huge because I remember, again, you maybe have a blueprint that you kind of follow or an idea of what you want to do. And then the person gets in front of you and you're like, okay, none of these exercises are going to work. We're not ready. We're not there yet. What do I do? So I think that we prepare you for those tough cases.
Wonderful. And then for existing myofunctional therapists, so we just opened up this course to them because we felt like it was such an opportunity, right, for them to learn more because you really are focusing on integration and the patient intake and really things that many orofacial myofunctional therapists practicing can benefit. So what are the top three things that existing myofunctional therapists would benefit from RDH myofunctional therapists?
Biggest one I would say would be the fact that we go over modalities. These things are going to supplement and supercharge your myo program because, myo is wonderful and amazing, but there's so many other things we could be doing that help on top of that to get that real true transformation for the patient.
Okay, I like that one. Modalities. Brittany, give me another one.
I think outside of obviously just taking the course, but that continued support and mentorship that we have, having the Facebook group to be able to present case studies in and things like that. And I'm back to my point that I made before. I think that oftentimes we get messages from hygienists who might have taken an intro course or 2 or 3 and still aren't really where they should be in their myo career. And, one of the proudest moments for Carice and I is to see it click for our attendees, right? And to see them then take everything they know and grow and literally like full force. A lot of our students are graduates. They're smack dab, they're in it. They're seeing patients, they're ready to go, they're confident. And after, Carice and I, for us to experience that, we're always texting each other like, oh my God, we're so excited for this person and that person. Do you see what they're doing? So I think that's really cool.
Right, so you build a community. Okay, terrific. And then let's talk about if any doctors are watching, dentists, pediatric dentists, even orthodontists. Why would they benefit from training a hygienist to have, sorry, my dogs are barking, to integrate into their dental practice with their hygienist? A lot of our doctors actually sponsor their hygienist to take our course. And why do you think that is? 3 top reasons.
I think one is that we definitely lead with how do you implement this into the office. So you leave the course, it's a Friday course. And so you leave it on Friday. On Monday, you have the tools, the tips, the techniques available in your toolbox, your mental toolbox, to be able to get this going on Monday.
Great.
I think that it differentiates you in your practice and your patients are able to have, the treatment that they need in the same 4 walls. That form and function that we know is so important to go hand in hand, they literally can receive in the same office.
Wonderful. And we had so many nice testimonials. I'm going to put them on our website, which we just newly launched, so I'm excited about. But what I hear most about is this tone, this over welcoming tone of just feeling like cared for and listened to, and that they feel understood and that they feel ready, that you kind of demystify the whole magical, myo. So we're really, really thrilled to have you guys on board. I'm just going to go ahead and share my screen in case people wanted to learn more about the course. You guys can see the myo screen?
Yes.
I love those pictures. Okay, so we have a course coming up. I'm just going to flip it over here so I'm not looking sideways. Okay, and I'm going to move us over here. Can you still see?
No, we just see our
Okay,
faces.
I just got 2 monitors. I feel so cool. but it's not working out so well. Hold on a second. 1 second. Okay. Great.
There
Okay,
we
here I
go.
am back again. All right, so we have a course coming up in March, kind of like March Myo Madness, March 4th and March 11th. It's a full day course, but we do have 5 hours of pre-recorded modules to take at your own pace if you're new. And what I really love about this is how you guys kind of break down the days so you can really know what we're going over. So please feel free to take a look at that. And then we have 3 new options actually, and we're doing a March Myo special. It's actually $1,000 off of the course because we really wanted to open up to more hygienists. We were getting a lot of kind of pushback on the pricing, but we know the ROI is good. So we're like, okay, let's see if we can give them a break on that. And we made it more of an a la carte option if you want extra support. So this way there's something for everybody. But if there are existing myofunctional therapists, you too can take the course. It just doesn't include the 5 hours of the pre-learned modules, and it doesn't have that ongoing support, but you can do that a la carte as well. And then this is really a unique feature, is that you basically, I guess, have almost like a study club going, right? Where it's 12 months, a year, where you can join as an existing myofunctional therapist to share your cases. Why don't you tell us a little bit about that mentorship as well?
Yeah, I mean, we have a lot of fun with that. We meet once a month. We'll send you the schedule, obviously, ahead of time, but you're able to really bring all questions to the table, whether it's about, treatment planning, case studies. If it's more of a business related question, that's also something that we are totally there to talk about. Any questions that you have. And what's really cool is because it is a group mentorship, you're learning from other people's questions and other, case studies and presentations and things like that.
Wonderful. Chris?
It's just a wonderful community learning environment where you learn not only from your own experiences and things that you have questions about, but things you never thought to ask a question about, or things that you didn't even think you should be doing. Now you're like, oh, it sparks ideas. And so it's a wonderful, supportive environment. Wow.
Well, we hope everyone takes advantage of this because, I'm going to stop my share, but it's so scary to do new things. It's also so exciting, it's like it goes hand in hand where it's like a roller coaster sometimes, but don't be afraid of the unknown. And this is in our scope of practice as licensed registered dental hygienists. It's in the scope of practice for dentists as well. So we do have dentists taking the course. But what we're so thrilled about is the opportunity to help your patients at another level, right? On a comprehensive care level. And especially, I loved your quote yesterday, Brittany, about the Jenga. Let me see if I can bring that up. Do you remember it offhand?
Yes, that not having myofunctional therapy as part of your dental treatment plan is like playing Jenga with every case, essentially, not really knowing what the outcome is going to be. Because if we don't, like Lauren said, fix that soft tissue dysfunction when that really is the true root cause of it all, it doesn't matter how much expansion you're giving to your patients, what appliance they're in, the structure and function go hand in hand. And like I said, I love Jenga. Don't get me wrong. Jenga is really fun, but I love my patients more. I don't want to be playing that with their case.
Exactly. And, all the top airway experts, even on the faculty now, Dr. Gelb, Dr. Moralia, Dr. Boyd, they all think it's a necessary part of treatment. So why not make it easier for your patients and enhance your career and enhance your practice? So we believe it's a win-win. We hope you check us out. It's airwayhealthsolutions.com/Myo. We're here to answer any questions. We're very supportive. I take calls all the time. So I also get a lot of calls for referrals. So if you're a dentist listening, if you want to become an airway dentist and really integrate this into your practice, reach out for me for more information. Anything else we want to close up with? I hope this was helpful. I think we covered a lot of bases about what Myo is, how you guys got started, and I don't see any setbacks. Do you?
No, I mean, we're excited for our March course, and we can't wait for everybody to get started and elevating your careers. I just think Myo is such a great lateral transition for hygienists. So nothing to be scared about. You will leave feeling confident and ready to be a true myofunctional therapist.
Amen. Okay, guys. Any questions, reach out. Thanks for your time. See you soon.
Bye.
Bye.